Welcome. I'm Dr. Gail Lowenstein. I'm a Western-trained physician, specializing in internal medicine, geriatrics, palliative care hospice, and holistic medicine. I started CAM Group, Complementary and Alternative Medicine Group, in 2002 for the purposes of sharing of expertise and access to information not otherwise available to individual practitioners. Though the group was started for healthcare professionals with an interest in alternative and holistic medicine, we expanded the group to include lay people. Our next CAM group meeting will be on September 28th, 2010 at 6:30 p.m. and the topic will be nutrition response testing. I have here with me Dr. Guy Furno, who is a chiropractor, who has advanced training in nutrition response testing. Dr. Furno, welcome.
Thank you. Thank you for having me again.
My pleasure. What is nutrition response testing?
Nutrition response testing is a non-invasive method of analyzing the body to find out what the underlying causes are of ill or non-optimum health.
So what made you go into this field?
Well, I wanted to help people utilizing non-invasive methods without drugs or surgery to help them gain optimum or functional health. I really wanted to help as many people as possible in a way that was restoring the body's normal function and respectful of the body's methods of healing itself.
How did you even learn about nutrition response testing?
I started nutrition response testing about 3 years ago. It was actually in a workshop with another doctor. I had been practicing for about 20 years and my patients were very happy. I've had some patients throughout my entire career. And one of the things that bothered me as a chiropractor was we would treat patients that had specific conditions that were going on, and they would keep showing up with the same problems over and over again. They were happy, we were getting them better, we were making them feel better, but I was starting to feel like it was just a band-aid for the problem. What I came to find out was that if the body is lacking the raw materials in it to correct the problem, if it's missing the genuine replacement parts, then it's not able to actually fix the problem. So it would kind of be like we were putting in a door and a frame into a new wall and setting it all up and leveling it and getting it perfect, and you would open the door and the whole thing would fall over. So we would repeat it again and level it and put it in and it would fall over again. So until we put the nails in, it wouldn't hold up.
Well, I first heard about nutrition response testing from my friend who's a nurse practitioner, and she had chronic Lyme disease and did not want to take the antibiotics again. So she found someone in upstate New York who was doing nutrition response testing and had such a dramatic improvement. She went from chronic fatigue, where she couldn't even work, to kickboxing. And when she got better, I searched and found Dr. Furno, who I have been going to personally for now the past year, because I was having some problems with my thyroid gland, and I have had dramatic improvement. So tell me, how is it that nutrition response testing works?
Well, with nutrition response testing, the first thing that we have to look at is if a patient has unresolved health conditions that aren't being corrected. They're not getting the results that they either expect or they're hoping for, whether they're seeing alternative practitioners or Western practitioners, it doesn't really matter. What we find is that if they're not getting well, there's usually a barrier to healing. And that barrier to healing has to be identified. It has to be identified, and the body has to be supported in such a way so that the body can overcome this barrier and then can go on into a more optimum health state.
How does nutrition response testing identify the barriers?
We use a technique called muscle testing to test the body. A normal, healthy body wants to heal. And it will heal most conditions regardless of whether it's from an injury or an illness. But it has to have the right raw materials inside of it to do that. It has to be able to have the proper nutrients to do that. So if you're nutrient deficient because you haven't been eating the proper foods or the proper foods aren't available to you, then you're going to start to have deficiencies in vitamins and minerals. If you start having deficiencies in vitamins and minerals, the organs in the body aren't going to work right. They don't have the gas to fuel them to do the things that they need to do. If the organs start to become dysfunctional because they don't have the fuel anymore, then they start to develop symptoms. And if this continues on in a repetitive cycle, your body becomes more and more deficient in vitamins and minerals, the organs become more dysfunctional, and then the symptoms either start to increase and elevate, or they become very chronic type conditions. It becomes a very downward spiral of health.
When I first went to you, you did many different kinds of non-invasive testing on me.
Correct.
You did some heart rate variability.
Yes.
And you did the muscle testing.
Correct.
And you found that I was switched and blocked, and that I had some heavy metals, some mercury in me, and some parasites, none of which Western medicine was able to pick up on a routine visit. And you found that these problems that I had not known I had were actually creating a problem with my whole body, in particular with my thyroid gland, which is why I went to you to begin with.
Mm-hmm.
So how is it that nutrition response testing can pick up these problems with the body that Western medicine doesn't know about?
Well, we're utilizing, as I said before, muscle testing. The best way to explain how muscle testing works is usually through demonstration. This doesn't really fit for that. But in essence, we can liken it to a condition called hypothermia. So if your body is exposed to extreme cold conditions, you fall into an icy river and whatnot, the body wants to protect the central organs. It knows that the heart, the lungs, the brain are most important to keep the body functioning and alive. So it's willing to sacrifice the extremities. It's willing to sacrifice the hands or the feet or the toes.
Like frostbite.
Exactly. So it's pulling energy and circulation away from the extremities in order to save the core. So the same thing happens when we're doing muscle testing. If I test a muscle, let's say I'm pushing down on your arm, we're looking to make sure that that muscle is strong first, that we have a good indicator. And then I'll test different areas of the body that correspond to different organs. If I press a part of the body that then causes a weakness in the arm, then we know that that organ or area of the body is under some type of stress. Now, exactly what it is, we don't know at this point, but we know that there's something going on because when I press on the muscle goes weak. Because the body's drawing energy away from the extremity to try and strengthen up that organ. Because when we touch that area, it's like we're adding more stress to it. So the body's trying to protect it. And then we look for different types of corrective causes with supplementation to put on the body. And we put on the body and we retest. When we find something that the body likes that's going to help energize that organ, then the muscle goes strong again because it doesn't have to divert that energy anymore.
And the supplements that you use are a standard process, which is a whole food supplement, correct?
Yes, the majority of products that we use are from a company called Standard Process. Standard Process is probably the highest quality products out on the market. And they are what's known as whole food supplementation, which means that they're made from live organic vegetables that are grown on their own farms, and they're processed minimally in such a way as to maintain the vitality within that product. So in essence, it's almost like a concentrated food that we're giving the body.
So who would be a candidate for nutrition response testing?
The candidate for nutrition response testing would be anybody who has unresolved health issues that have been going on for any period of time. Patients who have been to either Western trained physicians or alternative practitioners and aren't getting the results that they were looking for or that they had hoped for or had expected. Patients whose health issues are affecting their lives. They're either affecting their social lives, their family lives, their careers, their financial aspects. And patients that want to obtain maximum or optimum health.